Now it is the 21st of December. Have kind of our last checkup after the third infusion. So we'll see with Dr. Kraft, see if we're gonna keep going with this infusion, same medication, depending on how the CT looks. And I'll find out after his visit. Anything else?
No, we'll find out if the last 3 months of treatment has worked or not worked. So, yeah. So after today, we'll decide what the future will bring.
But we know what the future will bring. Paradise
Right.
soon, but
what our future course of action will be.
short-term future will be. Right.
Yeah.
Howdy.
Hi.
Hello, how are you today?
Doing all right?
Doing well.
Okay. So, I think things have grown a little bit, not a tremendous amount, and still located in that one place. When I calculated out, it sort of suggests that maybe we should go on to a different therapy from the immunotherapy. What is your feeling about that? I know you were hoping this would work and it would shrink away, all of that sort of thing, but it didn't.
Great.
I'm not a big fan of the tumor, what it is, where it is, and how I'm feeling with it. So, as I was telling Dr. Chen, I'm not too comfortable with this alien in my body. That's
Okay,
and it's
the ache and the pain and all of this sort of thing. So
and it's like always on my mind. When you feel it there and you know that it's there, it's like it's kind of psychologically disturbing, to have that.
So you were seen by surgery, I guess, before we started the immunotherapy.
Warnicki, yeah, I think he did that, or one of his team did the biopsy.
And they had talked about sort of a big surgery, and you were trying to avoid that.
Yeah.
So
I'm trying to avoid anything bad, so if you can just, come up with something rainbowish and butterflies and
But we still need it there, right? To see if we do chemo, that the chemo's working.
I
don't think-
because that's kind of the issue that we had before, and not having anything to judge whether the chemo was working. It was tough for us to.
So, one approach is to see if we couldn't use more standard chemotherapy, try to shrink it, get the pain away, and then go for either surgery or radiation to kind of deal with it. Are you okay with that? Maybe starting after the holiday? Or what are your thoughts around that sort of thing?
I mean, I guess we ought to try something. I mean, nothing's going to be great, but
Well, you've been through a lot before, and you're a real trooper. You've had some major surgeries, and Linda. And this is one of our other nurses who's kind of shadowing us today. You've had this major leg operation. This is a disease that you've learned, and we know, sort of goes and comes, and if we can deal with it when it comes and sort of put it to bed, maybe we can get another number of months, and then there are always new therapies. I was just back from a meeting, and there's 10 new immunotherapies that people are trying, so there's always new things coming.
Because even, I kind of, I'm thinking even if we do, some chemo, that would be nice for it to shrink, and if we can, a lot of times I'm not exactly sure what occurs to the tumor, while it's shrinking. Does it ever get to a point where it will just die and the body will absorb it on chemotherapy? Because I'm thinking, okay, what if we did chemo and shrunk it so much that it died, and then go back to immunotherapy to kind of keep it at bay or something like that?
I mean, all that's what people are thinking about, but that isn't usually. I mean, my experience with synovial cell with standard chemotherapy is we get 30%, 65% kind of shrinkage, doesn't totally go away, then we kind of resect it.
Mm-hmm.
So that would be, you know, or in your case, if it's not so easily resected, then we irradiate that area if we can get some good shrinkage.
Right.
And that would be the approach I kind of use.
And does the radiation then kill the rest of it?
The
So you don't need
radiation
surgery?
kills the rest of it, so you don't need surgery. But
Okay.
I'm not a radiation therapist,
Yeah.
and you know, they have to talk to you about side effects and other things.
Yeah.
You know,
Well, I've done that before. So.
You've done it before, yeah.
Mhm.
So you know the drill. You know, I think what we need to do is run the drill right now and see where we can go. I mean, it didn't grow tremendously on the immunotherapy over the 3 months, but it did grow. And when Linda and I we did the math, it was greater than a 20% increase, which is kind of our borderline for keeping things versus not keeping things. I would suggest doing a couple of 2-3 cycles of standard chemotherapy, seeing if we can get some shrinkage out of it, and then having a plan around either surgery or radiation.
Okay.
When you say standard, would it be the one we did last year? Do you know?
I can't remember.
We did Doxil last year.
Yeah, no, Doxil is not where we want to go. I think it's a good chemo, but it's on the weaker side. So, you know, I think you've done Adria IFOS in the past.
In 2006, I think you had it. That was
Yeah.
the chemo you originally had back in the day,
Yeah.
before the surgery the very first time.
Yeah.
Right.
Yeah, so that's
As soon as we got married.
that's where we want to go. Well,
Oh, okay.
life
was fun.
Life has a lot of ups and downs for everyone.
Yeah.
You're not alone.
Yeah,
you know,
yeah.
So.
Has it changed any since then? That
That
Chemo,
chemo
what is it?
has not changed that much, although everybody kind of uses it a little bit differently.
Yeah. Okay.
Uh-huh.
And I know there's a lifetime use. Did we ever check on
Yeah,
that?
I think what we need to do is to check his EF. You know, that's the cardiac thing. If that's good, then I think we could go ahead. Again, our plan is not to give a huge amount, to see kind of where we go.
Yeah.
Okay. So let's give that a try. See if we can shrink it some, and that might make you more amenable to surgery. If we can get some shrinkage, I think some of that pain's going to go away. That'll allow you to deal with every day, you know, as it comes a little bit better.
And then looking, I know we don't have a crystal ball, but looking past that, I mean, does that type of chemo maybe help keep it at bay?
Yeah, yeah.
I mean, of course, would you have to continue it for that to happen, or if we did?
No, the idea would be to get some shrinkage, and then you know, have the surgery, and that would be it.
And then hopefully we don't have any new tumors for a while.
Yeah, for
Yeah.
a while or forever.
Yeah.
You
Yeah.
know, is there an end to the rainbow the way
Right,
it is?
right. Yeah.
There are always new things coming
Yeah,
out,
so
and
maybe something else.
there are some new immunotherapies. I mean, let's see if we can't, you know, put it at bay through some procedure, and then from there kind of see if science can catch up with us a little bit. Okay? But the immunotherapy, you know, we don't truly have a sense of, you know, did it slow it down? I mean, you don't there's no way to figure that out, but it did grow some under that. So I think we need to kind of move on.
Yeah.
Yeah.
let's celebrate Christmas. Maybe next week we can give the chemotherapy, or the following week. What do you think?
Whenever, I guess I gotta set up the EF test and get that done, I guess, next week. And
our son's off
And then-
school for 2 weeks, so
Yes.
maybe wait till he goes back to school.
Back
Yeah.
on the 4th then maybe?
yeah.
Then set up, we'll find out.
Yeah, let's do it. Let's do it then. We'll veg out for a little bit. Eat all that holiday candy and stuff. Okay,
All right,
we're there together, and we're going to work together on this. Let's see if we can get some shrinkage and then go from there.
All right, thank you.
Oh yeah, so I just went over the math also. So it was the total volume that's gone up by quite a bit. So each of the individual dimensions went up by a very small amount. When you multiply the total volume of it, that's where it got.
Yeah.
This is your copy.
Each of the dimension went up by maybe like 15 to 20%, but when you do
Put them all together.
all together, that's when he's got the
So
pretty big.
that's
Yeah,
where
pretty-
we got this.
Gotcha.
Yeah.
So it went from like a volume of 160 centimeters cubed to 250 basically. Even each of them is pretty small. So
Yeah.
we'll set you up for the ultrasound. That's ordered.
Yeah.
And then I think we'll
So the ultrasound does what?
The echo.
The echo.
Do the
Ejection
echo.
fracture.
checks
They're
your
just
heart.
checking the strength of the
You
heart.
could say ultrasound, you could say echo, it's the same thing. They just
Okay.
look at the ejection fraction of the heart. So
Make sure it can handle it.
Yes.
Okay.
So what they do is they look at the right ventricle, and they look at the blood flow, if it has the ability to push out, and that's what they look at for the echo.
Okay.
And then we'll get that.
Hello, family and friends and concerned
Individuals.
individuals. So back in the truck, headed home. So we talked to Dr. Kraft, and it looks like the findings from the CT show that the tumor did grow by 60% in mass. So the indication is that the immunotherapy is not working. The resident at first was kind of thinking, well, we should give it more time, give it a chance. It did slow the growth, but Dr. Kraft feels like, he said usually anything over 20% growth, they don't look at as a win. So we're going to switch to chemotherapy. Back to the one that Paul did in 2006. Rather than doing it in the hospital, though, he takes it home basically and is infused for the 5 days at home. So he does have to come back every morning for 5 days and get a new bag hooked up. But
Yep.
So we'll start that on January the 9th, and then that's for 1 week every 3 weeks, and we'll do that 3 times. So probably another 3 months basically, and then
January,
we'll,
February, March.
Mhm.
So try and finish up in April, end of March.
end of March. So then we'll do another scan, and we'll see if it has shrunk, and at that time either perhaps do radiation to kill the rest, or perhaps surgery to remove it. That we'll have to kind of decide after we see the changes in the 3 months.
Yep.
So
So get a good look at the hair. The pretty locks. They're going away.
yeah, that's right, huh? I forgot about that.
Yeah.
And
That's what you cared about.
Mr. Clean, I'll be married to again.
Yeah.
But
Right.
yeah. So no doubt side effects will be a little tougher again than what we've had the last 3 months. But we will prevail.
But I will survive. As long as I know how to love, I know I'll be alive. Something like that.
We'll survive. All right. So we'll keep you posted.